Hello, and welcome to this edition of the Manatee Glens Report. I'm Mary Ruiz, President and CEO of Manatee Glens, the leading specialty hospital and outpatient practice for mental health and addictions in our region. On our show today, we're going to talk about a disorder that affects more than 31 million Americans during their lifetime, post-traumatic stress disorder. I'd like to welcome Emily Walsh-Perry to the show with Sunshine from Darkness. This nonprofit, volunteer-driven organization is dedicated to increasing public awareness of mental illness and brain disorders. Sunshine from Darkness also raises funds for research to find the most effective treatments and one day soon a cure. Emily is the event chair for the Journey to Wellness Symposium and Gala coming up on Saturday, January 14th in Sarasota. One day, two events. We will also be hearing more about that later in the program. I'd also like to welcome Colonel Benjamin Nisley to the show. Colonel Nisley is a 27-year veteran of the United States Army. He served in Vietnam, where he was shot down while piloting a medevac helicopter. He has received the Meritorious Service Medal, 2 Purple Hearts, and the Bronze Star for his service. He currently serves on the board of Operation Second Chance. We'll hear more about that later in the show, and the Sarasota Military Academy. Thank you both for appearing on the Manatee Glens Report.
Thank you for having us.
Thank you.
Emily, each January, Sunshine from Darkness puts a spotlight on serious mental health issues such as schizophrenia, bipolar, and depression. Why did you decide to focus this year on post-traumatic stress disorder?
Post-traumatic stress disorder is kind of a hot topic right now with all of our soldiers returning from Afghanistan and Iraq. So that's why we chose that. But it also affects more than just soldiers as well.
Yes, it does. I think at Manatee Glens, what we've realized as clinicians is that trauma is the rule, not the exception. Many people come to us with life experiences that are traumatic: a divorce, loss of a parent, a child, or a spouse, a car accident, a medical issue. And so we're trying to focus on trauma-informed care no matter what diagnosis people present to us. So we're very pleased to hear that Sunshine from Darkness is focusing on this important issue. Former Congressman Patrick Kennedy will be a keynote at the January 14th Sunshine from Darkness Symposium. Congratulations.
Thank you.
That's wonderful. He also will do some congratulations because he's receiving the Luminary Award for advocacy for brain disorders. In 2008, Congressman Kennedy sponsored the Mental Health Parity and Addictions Equity Act, a historic piece of legislation. Emily, why do Americans need parity for mental health and addiction?
Americans need parity for mental health and addiction because these illnesses are just like any other illness, and they should be treated that way as well. So the insurance that's available for people hasn't treated them equally. Correct, and there's been a stigma that these illnesses, that you just go get better, pick yourself up, you'll be fine. But it's not true. It needs to be treated seriously with medical attention and care.
And medical treatments do work, which is why
Correct.
It's a medical disorder. And people have encountered problems with their insurance: higher deductibles, more limited services, higher copays, higher levels of authorizations and hassles, and it's kept people from getting care. So I'm pleased to hear that Congressman Kennedy is going to get recognition for trying to end that discrimination.
And that's why we're giving him the Luminary Award for all of his service. And this is a real passion for him because he, has it in his family as well. And PTSD is also one of his other passions too. So we're very pleased that he's coming.
So people can see Congressman Kennedy on the 14th at the symposium.
Correct. He's going to speak about this specifically. So
Emily, one of the things about your experience with Sunshine from Darkness is you were led to become an advocate because of your personal experience. Can you tell us what about that journey led you to Sunshine from Darkness and being so open?
Sure. I suffer from depression, and I experienced it a couple of onsets in my 19 and early 20s. And suffering from depression, after getting treatment, and mental illness affects 1 in 4 people. And so you often come along people who have it in their families as well. And that's how I met Lee Peterson, who's one of the founders of Sunshine from Darkness, and her son has schizophrenia. And I was talking to her about, well, I suffer from depression, so I understand, and she encouraged me and helped guide me to speak out on about my depression, so that other people can see that you can live a happy and healthy life, successful life, with mental illness.
And in fact, you do have a successful life. You work for the Observer Group.
Correct.
Which is a series of business newspapers in our area, and you have a 1.5-year-old
yes,
son.
I do, and he's a joy of my life. Yeah, he's great. So yeah, and I just want to get out there that people, that you can be it's normal, that stop the stigma that comes along with mental illness.
So often people feel very alone when they first find out that they're struggling with a brain disorder, and actually it is a very common disorder.
Right.
We're not alone in this, and so thank you for your courage in speaking out. Colonel Knisley, you too have displayed courage more than just on the battlefield. In 2000, by speaking out about your own story with post-traumatic stress disorder, would you share just a little bit about how that's affected your life?
Much like Emily's story, 40 years ago, I was shot down in combat, and as a result of that, I experienced dreams that relived the incident. And interestingly enough, those dreams have never gone away. I don't believe they've ever, while it has certainly been a PTSD issue, such has not caused me to be ineffective, but at the same time it's there, and I have an appreciation for what happens to folks who experience the trauma you talk about. That doesn't have to be combat. It could be one of many, many experiences in their life that just
so you both
gets
share
filed away.
You both share in common dealing with your own recovery by helping others.
Right.
Exactly.
So that's one of the ways that people can find support in dealing with mental illness. Colonel, in 2009, the Armed Services released a chilling report that America lost more soldiers to suicide than to combat. And the military is stepping up to help soldiers. Can you talk about what's available for families and soldiers?
Yes, that report was I suppose, a shock and a wake-up call to the Pentagon. Not only the Army, but all the services realized the statistics that had confronted them at that point. Since then, in the case of the Army, the Vice Chief of Staff has instituted a special task force to deal with the trauma that manifests itself in mental behavioral issues. It isn't a surprise if you think about the environment that young soldiers, sailors, and airmen are exposed to today, the multiple deployments that we are forcing them to go back. The Army,
there is no front.
That's true, and the Army is now very reliant upon the reserve forces, and the reserve forces are soldier citizens. They have jobs. They deploy, and again we turn them around in multiple deployments. So they, for the most part, are older. They have families. They have children, and on top of that, the stress that they are confronted with in this 10-year-long war now is very, very intense. You don't see the enemy. You don't know what the weapons are, yet you know and you observe the sorts of tremendous results of these IEDs. So the issue is that they never get to relax. Even in bed, even at night, they're always on guard because you never know where this unknown terrorist enemy is coming from. And that manifests itself over time to be a very significant, stressful issue.
So the military has just about doubled their behavioral health personnel.
Absolutely. Since that report, again, the Vice Chief of Staff made this a very intense study that he gets briefed on weekly. We've doubled, the Army has doubled its staff and group of counselors in behavioral medicine and health care. And incidentally, we've also doubled the staff with regard to substance abuse counselors. And again, it has been I think the report was a good thing. It was a wake-up call. and we're seeing very good results from this.
So
new
now
task force.
our armed forces have more help while they're in active duty, and more help after they've retired.
in
We
fact,
have a clinic here on the VA on State Road 64 here in Manatee.
Yes. In fact, when a soldier returns from deployment now, they actually undergo a program of sort of decombatization or reintegration before they're even released to go home, to make sure they understand the stresses and the challenges they're going to deal with in coming back to the life that they left 6 months or a year earlier.
So one of the places for information that people can get is the January 14th symposium, Sunshine from Darkness. There's going to be a special screening in addition to speakers who are experts on post-traumatic disorder. The film is called Halfway Home by Paul Friedman. Tell us, Emily, a little bit about our speakers that day, and we'll talk some more about the film.
Dr. Charles Hogue, who headed up the research department at Walter Reed for psychiatry, he will be speaking specifically about PTSD. And then we will show the film by Paul Friedman, which also stars Sergeant Tommy Ryman, who is with the Army and suffers from PTSD, and he is featured in this film. And he's going to, in addition to seeing him in the film, he's going to talk more about his personal experiences and open up to let people ask him questions about how he copes with it and deals with it.
So the Van Wezel holds about 1,700, 1,800 people.
Correct.
There's plenty of room.
Yes.
It's free. The doors open at 8.
8 a.m.
And the presentations and the film will go to
probably about 12:31. And also, Patrick Kennedy will speak as well at the symposium about what's going on in Washington and research and things like that.
So it sounds like a great morning for families and people who are concerned about post-traumatic stress disorder.
Yes, and we also have during breaks, there's a community information room where all the local health services, mental health services, and also we're going to have some VA services there. They will be there for people who need to seek information from these local organizations that offer services to people who need help now. So.
The tagline for the film is very profound. It says, soldiers go to war. Some come back, some don't. Others only make it halfway home. Colonel Nicely, do these words fit your experience as a combat veteran?
Yes, it does. Make no mistake about it. PTSD is a wounding, just like all the other wounds that a combat veteran can have. And it supports the old adage that so-and-so went away one person and came back another. So often that's the case. The mental malady of PTSD runs the full spectrum. It can be something very mild, and yet it can be something very debilitating. So that subject of the movie is, in fact, or that strip, is very, very apropos, no question about it.
You were telling me a story of a young woman who was suffering from post-traumatic stress disorder. Tell us about her experience, because I think it's very, very illustrative of what our armed forces are going through when they come back home.
Case of a young 30-year-old Marine female who encountered a very traumatic event while inside a compound of what one would think is a safe compound in Iraq. And as a result of dealing with that issue, she was discharged from the Marines with PTSD as a diagnosis of her honorable discharge. And she shared with me, she said, I wish I would have lost an arm or a leg. She says, because I can't get a job. She says, when I go before the HR people after applying for work, and they see that I have PTSD on my record, she says, they very subtly and very politely let me know that I'm just not somebody they're looking for.
So there's not only stigma, there's discrimination.
Exactly. And she said, I actually know if I had just an arm lost, I'd get a job. She says, but I'm having a very difficult time. And it brings to light the stigma or the need for further education among our own corporate entities and among our own total population, that PTSD is not something spooky, it's not something weird. as this poor lady sees, you know, it is strictly just another wound that we can easily deal with.
And as we said earlier, it's not just unique to soldiers.
Exactly.
People who've been through major traffic accidents.
Exactly.
Very spooky about driving and hypervigilant and jumpy, and yet we don't worry about giving those people jobs, do we?
Exactly. You know, with the physical injuries are easy to see, and all sorts of resources are there to help. But the mental injuries, you know, still have that holdback and that feeling on the part of the public that I can't see the problem, and they're not quite as readily able to accept and deal with it.
So it's good that Sunshine from Darkness is bringing this out and kind of making this a community issue.
Right.
Colonel Nilesley, what, in your experience, what works for our armed forces when they come back home and they're only halfway home?
I think the main thing I would say about that is that they need to be, you know, it's the family members, it's the spouses that see the difference in a person. The patient themselves often do not realize how they have changed or how different they are. So certainly we need to be very tenacious. Those family members need to be tenacious in seeking help, identifying that, you know, Sergeant John or Sergeant Bob is not the same person he was. There's, as we will see later and as we'll discuss later, there are plenty of resources available for help. I think, though, that you just have to get past that fear of identifying that I do need help. And I would have to say that most of the people should rely upon their close family to help them understand that they need to seek that help.
In the film we're showing at the symposium that focuses on Sergeant Ryman, his wife was a key role in getting him help because she was the one who noticed immediately that something was different. And in the film, she goes into, you know, how she helped him get there to treatment.
Exactly.
So yeah.
Sometimes the families themselves are suffering from post-traumatic disorder. When you have a loved one deployed and you're watching these reports on the news about another soldier lost, and maybe you haven't heard from your loved one as usual, and people after a long period of time in these multiple deployments, even the families can become post-traumatic, and so there's help for those folks as well. Colonel, your war was Vietnam. You've talked a little bit about how Iraq and Afghanistan are different for the soldiers. Can you tell us some more about why maybe these wars compound the problem with post-traumatic stress disorder?
You know, it's a very interesting question. Combat is combat, but this particular war on terrorism is now, of course, our longest war that our nation has chronologically been in, over 10 years now. I think that the intenseness, again, of the stress, the repeated deployments, of the fact that our Army or our forces that fight this war are smaller than before, so they're subjected to go back again. Couple that with the economy, again with families struggling to deal with that issue. I believe that the environment is in fact very indicative of what that 2009 report highlighted that you mentioned. It is a stressful time. And we in the American public need to understand that and assist in everything we can. You know, we've done a great job at welcoming the soldiers and the sailors, airmen, Marines back home. Unlike the Vietnam era, when it was almost, the soldiers almost didn't want to be seen coming back. They were ridiculed. That's not true at all today. But I think the big step we need to make today is to make sure we understand that PTSD is just another wound, and it's treatable, and it's not anything that needs to be hidden in the closet or not talked about among the family members.
Well, Operation Second Chance helps soldiers deal with this issue and kind of reintegrate. Tell us what the organization's all about. Operation
Second Chance is one of several underneath the umbrella we would call Wounded Warrior Project. we assist in various ways the families and the soldiers, all servicemen who come back and are hospitalized. One of the, of course, we buy everything from plane tickets for families to come to Washington, or whatever the needs are of a particular family. One of the highlights of our mission is when soldiers are ready to leave the hospital, not ready to leave totally, but they are healthy enough to come out of those white walls. They may have been there for many months with in the amputee ward or traumatic brain ward. We bring them out for a 2 or 3, 4 day excursion, we call it, to get them out of the hospital on a trip, and we ask the soldiers, what would you like to do? Some say, AJ, I want to go fishing, I want to go whitewater rafting, I want to, whatever, I want a horseback ride. So we have programs where we bring these folks out. We generally fly them on the Veterans Airlift Command in a group to a particular site, and it's a 2 or 3 day getaway. It's absolutely amazing the healing that occurs during those sort of trips, where they go back from there, back to the hospital, and in every case, the medical teams will say, oh my gosh, what a change in that individual, to get him away and get them out, because they, for the first time, now have to perceive how they look to the public. They might look different. They might have a disfigurement, or they might have a prosthetic arm or a leg, and they have to begin to deal with, I'm different now. I can make it, I'm okay. But they have to begin to see, how do these folks look at me? And these trips are very valuable in that regard.
That sounds wonderful. And of course, those kinds of things could happen in your church or
Absolutely.
your neighborhood.
Absolutely.
So we could all take a veteran to the ball game.
You bet. You bet.
Something that they might enjoy. That's a wonderful, wonderful mission. And we've been talking that post-traumatic stress disorder is a brain disorder with all of the stigma and confusion that comes about. But the brain is a physical organ, just like our kidneys or our liver or our heart. And Emily, I know that Sunshine from Darkness raises funds for research into brain disorders. Can you tell us how that works and why you do it?
Well, we do it because we want to understand the mind, and we want to be able to find better treatments for things like PTSD, and maybe one day soon cures for these disorders and schizophrenia, depression, bipolar, all the brain disorders. Wouldn't that be an amazing place?
The brain is hard to figure out. It's very
right.
complex.
And it's interesting that no one's figured it out yet. So it's kind of an exciting field to be in, to be a part of that research. How we do it is we raise funds from our annual gala, and we have partnered with the International Mental Health Research Organization, and we utilize their scientific advisory board, which is comprised of I think it's 13 of the top scientists in the field of mental illness right now in the U.S. and abroad, and they direct our funds to to research grants for some of the shining stars, the new young I think we call them rising stars in the world of mental health research, and we direct our funds to their research projects.
And that was the aspiration of the founders, Bob and Lee Peterson, to find better treatments and to find cures for these brain
Correct.
disorders. So we're going to raise money at a wonderful gala at the Ritz on January 14th at 6. So tell us what your guests will expect.
Yeah. So our symposium is earlier that day, and then that evening we culminate the whole day with an exciting event, our annual gala, and people will arrive at the Ritz, and there'll be cocktails and hors d'oeuvres, and then we'll have a fabulous dinner by the Ritz's culinary team, but we will also be entertained by the Sarasota Military Academy, their color guard, and I believe even their band are going to perform for us. And then we'll also present the Luminary Award to Patrick Kennedy, and he'll speak for a longer period of time at the gala, talking about all of his work he's done in the world of mental illness, and also about his new passion, which he's created this organization called One Mind for Research, where he's gathering all the top scientists who do anything with the brain, Alzheimer's, Parkinson's, in addition to mental illness, so they can pool all their research and efforts to really figure out, they have to figure out how the brain works first, and then all these diseases we can find better treatments.
And one breakthrough may mean good news for
everyone,
for many kinds of disorders. So the tickets are $250 for this wonderful evening, and they're available online.
Correct.
At www.sunshinefromdarkness.org, and it'll come up on our screen before our program closes. So I guess we are almost out of time, so we should close. Emily, what have you learned about living with and recovering from depression that you'd like to offer to our audience?
I guess the best thing that has worked for me is actually learning about my particular disease, learning about depression, learning what it does, how it affects you. So now I actually know all the trigger points. I know how to manage, when I can see myself stepping off just a little too far. I know that, I need to step back, or I need to call my psychiatrist or reach out to a family member. If you know about your disease and you're not ashamed of it, then you can live a happy and healthy life.
Oh, that's wonderful, wonderful advice. Colonel Knisley, what should family members and the rest of us do to better support people, veterans struggling with
I think the same thing, just simply tack on to what Emily said. Seek help. Don't be ashamed at all of the fact that you have a mental disorder, and diligently seek that assistance from organizations. The resources are there. And the other thing I would say to employers is give these soldiers who are coming back, give them a job. Take a chance on them. You'll find that they won't fail you. But they need someone. Because
they're disciplined, they're
exactly,
well-trained.
They're what you want, they're what you
they're
need.
They're veterans.
And give them a chance, give them that job that they look for. And don't worry about that small piece on their record about PTSD. They'll conquer that, and they'll get past that for the most part.
Well, that is good advice. And at Manatee Glens, we really focus on recovery, not illness. Emily, you really spoke well about knowing what the relapse points might be and how to prevent it. It's the same process that you would go through with any physical weakness. Diabetics know what they can eat and what they can't. People with weak kidneys know they have to avoid salt. Yeah. So it's no different really than any other illness if we treat it that way. So thank you both for appearing on the program. I really appreciate all of the advocacy that you do for people with post-traumatic stress disorders and mental illness. We're looking forward to seeing your school. You're on the board of directors for the Sarasota Military Academy at the gala. And
great group.
Seeing you all at the symposium on January 14th. That will conclude this edition of the Manatee Glens Report, and I want to thank again our guest, Emily Walsh-Perry and Colonel Benjamin Knisley, for being here today, and thank you, our audience, for stopping by to see us here on METV, where you can learn something new every day. We'll see you next time.